Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
Well, women may be more likely to get Alzheimer's disease, but men are typically diagnosed sooner. Now, by tweaking memory tests just a little bit, more women might be caught at an early stage of the disease.
Here to explain is, I'm reading exactly what it says, and that's not right.
Oh, sorry.
What should that say?
Here to explain is Dr. Michelle Mielke, Professor of Epidemiology and Neurology at Mayo Clinic.
Here to explain is Dr. Michelle Mielke, Professor of Epidemiology and Neurology at Mayo Clinic. Welcome to the program, Dr. Mielke.
Oh, thank you. It's great to be here.
And Dr. Mielke, nice to have you. Is it really true that women have better verbal skills and better memories than men?
Yes, it is.
I guess I can't argue with you two.
So how it's men and women present differently with Alzheimer's, or what are you saying?
Well, so let me take a step back and talk about some of the questions that we've raised, because it's a little bit more complicated. In terms of general cognition, on average, women typically perform better in terms of verbal memory.
Cognition meaning brain function.
Brain function.
Ability to think. Okay.
Yes, exactly. But men, you've probably heard the cliches and whatnot, generally do better on visual spatial functions. And so sometimes you might hear, well, men are supposed to be better at directions than women are. That's kind of one of the thoughts from that in terms of the visual spatial abilities.
And we're better drivers, too.
No,
because
we're not going into
that.
Topic.
No.
Okay, so that is the reason why when you're testing for Alzheimer's, how you test men or women makes a difference.
Yes. Yes. So when we're testing for Alzheimer's disease or really any type of dementia, when somebody comes with some cognitive issues, we don't know what the cause is or exactly what those cognitive issues are. So a lot of times we think of, with brain changes, we think in memory, but it can be visual spatial. It can be problems with language. It can be problems with drawing. It can be problems even with planning. Thinking about that. And so one reason we do the memory or the brain tests, cognitive tests, is to try and figure out what domains are affected in the brain. And that can kind of give us a clue as to what some of the causes are. Now, one of the complications with that, as we just talked about, is that women generally do better on verbal memory and men generally do better on visual spatial functions. But when we're thinking about Alzheimer's disease, we think about memory. And so the verbal memory tests are really one of the main tests that we focus on to diagnose Alzheimer's disease. And so if women are doing better at it, then it's possible that they can be diagnosed later. Because if you're using the same score for determining abnormality or cognitive problems, then women might not be down to that score yet, but they might have already had a drop and still be considered normal.
Because they're smarter, because they have better verbal skills and memory, they're able to compensate. And
right.
They do better on the test, even though they might have the disease or might have a cognitive disability, or they might have dementia, or they might have Alzheimer's. And explain the difference between all of those three terms.
Okay.
Cognition, dementia, Alzheimer's.
So when we're measuring cognition, we're trying to measure the different ways the brain functions. And there's a lot of different ways that the brain can function. I talked about memory. I talked about planning, kind of visual spatial. So there's a lot of different ways to measure in terms of how your brain is doing. Now, mild cognitive impairment is a stage between being cognitively normal and having dementia. And with mild cognitive impairment, there are changes in your cognition. It can be whether it's memory or visual spatial, it can be any of these different changes. But the key aspect is that what makes it different from dementia is that with dementia, it interferes with your daily living. So by forgetting names and whatnot may or may not be a sign of mild cognitive impairment. There's some people that just are not good with names. I'm one of those, for example. And so it's that change that's important. But when it gets to the point where, forgetting to turn your stove off, you can't find your keys, it's really impacting your daily life, that's when it becomes dementia. Now, in terms of women and men, one reason why we're interested in looking at these differences for verbal memory test is because for diagnoses of MCI, most studies across the world have shown that men are more likely to have MCI than women are.
What does MCI mean?
Oh, I'm sorry.
Mild cognitive
impairment.
Gotcha. Just wanted to be sure.
Yeah.
Right. But interestingly, when you look at a man and woman with mild cognitive impairment, women were progressing faster to a diagnosis of dementia. And so we were trying to figure out why that would be. And so that's why we came upon with the verbal memory test, thinking that, well, maybe if they're diagnosed later because they're kind of being masked and are doing better on the test, that's why they're converting faster.
So explain the difference between dementia and Alzheimer's disease. Are they the same thing, or is it just that Alzheimer is the most common form of dementia?
Yes. So dementia is a general syndrome. And Alzheimer's disease is one of the main causes of dementia. So dementia is all-encompassing. It can incorporate many different types of causes. So, for example, if you have a stroke, oftentimes we'll call that vascular dementia. If you have cognitive problems, there's Alzheimer's disease, there's Parkinson's disease, dementia as well. So dementia kind of covers all of this.
So what you're saying is that women aren't progressing faster to Alzheimer's disease. It's just they're not, when they're being tested, they're able to fool the testing, so to speak. They still have the Alzheimer's that is progressing, but they've been trained on how to outsmart the test. Is that a way to say it?
That it is, yes. They do better on the test. And so, and that was really the focus of the research, to try and understand why, they seem to be progressing faster, where it doesn't seem like that's necessarily the case. It's just that they're being diagnosed a little bit later, and so they progress faster to impairment.
So you need to score the test differently.
Yes. So that's what the future research and clinical goals are right now. We have some work trying to rescore the test differently for men and women, determining what would be a good determination of what might be impairment for each of them, and then trying to figure out how best to incorporate this into the clinic as well as in research studies.
Well, rescoring the test is one way. Could you test in a different way? Is there research in that area?
There's a lot of there's different ways to test for memory. Verbal memory does seem to be more specific to Alzheimer's disease, and so that's why it tends to be so important to test when we're concerned that might be one of the cause of the changes.
So the obvious question, though, is what difference does it make? We don't have any treatment for Alzheimer's disease anyway.
So you're right. The treatment that are currently approved by the Food and Drug Administration are primarily symptomatic. There are some really promising drugs, I think, in clinical trials at this time frame. But even if those don't come to bear in the very near future, diagnosing earlier is always important. Number one, always thinking about family planning. But secondly, there are ways to potentially delay progression to dementia.
Diet and exercise, you're speaking of?
Diet and exercise, yes. It comes up again and again, but we're finding that it certainly does impact progression. So diet, exercise, also social communication, getting out, doing things. It doesn't mean you necessarily have to do crossword puzzles, but finding something that you enjoy and engaging in the community does show to help delay memory problems.
All right, so I think the bottom line is that adjusting the way you score the test may allow you to diagnose Alzheimer's disease, dementia, earlier in women.
Yes.
And that's important for multiple reasons, and mainly because, or partly because, we may have a drug to treat this disease someday.
I hope so.
All right, Dr. Michelle Mielke is a professor of epidemiology and neurology at the Mayo Clinic. Thanks, Dr. Mielke.
Thank you.